For more than 100 years, joint replacement surgery has been used to treat patients with chronic hip pain. Today, these surgical techniques are being combined with a new technology, and it's changing the way joint pain sufferers receive care. Meet Mako, a robotic arm-assisted technology used by surgeons to perform total hip replacements. This unique technology helps surgeons provide a personalized surgical experience where each surgical plan is based on a patient-specific diagnosis and anatomy. Here's how it works. It begins with a CAT scan or CT scan of the hip joint. A CT scan is a series of X-rays taken at different angles that can help surgeons see things that they can't typically see with an X-ray alone. The CT scan data is used to generate a 3D virtual model of the patient's unique anatomy. This virtual model is loaded into the Mako system software and is used to create a personalized preoperative plan. Prior to surgery, the surgeon reviews the plan size and placement of the implant. If necessary, the surgeon modifies the preoperative plan to help control important measures of hip stability. During surgery, the surgeon locates points on the hip in order to register the anatomy in the Mako system. This process establishes the relationship between the patient's actual anatomy in the operating room and the 3D model that was used during the planning process. This step helps ensure the procedure is executed to plan. Once the anatomy is registered to the 3D model, the surgeon has the flexibility to modify the preoperative plan based on their assessment of the patient's anatomy. Then, the surgeon guides the robotic arm to remove the arthritic bone and cartilage from the hip. A virtual boundary provides tactile resistance to prevent the surgeon from removing more than just the arthritic bone identified in the preoperative plan. And visual cues, shown in green, appear on screen to show how much bone to remove. Collectively, this helps provide more accurate placement of the implant to the surgeon's preoperative plan. Mako assists the surgeon in performing controlled and accurate preparation of the hip socket. As the surgeon prepares to place the implant into its final position, the robotic arm guides the cup at the desired angle defined in the surgical plan. With the diseased bone gone, a total hip implant is inserted in the joint space. And that's how Mako Total Hip is transforming joint replacement.
I am the mother of 3. I am the grandmother of 1. I have a husband who's a firefighter who's very active. For 20 years, I was an operating room nurse where I was on my feet all day. I was also very physically active. Biking, running, hiking, I was involved in everything. The first time I experienced hip pain was after a race. I didn't think anything of it. I thought that it would go away, so I kept pushing myself at work and with my weekly exercise routine. But I found myself slowing down. My range of motion kept decreasing and I couldn't do the things that I used to do. When I finally decided to speak to an orthopedic specialist, it was too late. The arthritis had worn down the cartilage in my hip, creating bone-on-bone contact. It got to the point where the only recommended treatment option by my surgeon was to have a total hip replacement. Hip pain is exhausting. It is debilitating. I couldn't sleep more than an hour at night. I had trouble walking any distance at all. I stopped exercising completely. It's debilitating and depressing. It affected every aspect of my life. The pain eventually became so bad, I was looking forward to surgery. Looking back, I can't believe I waited so long. I had surgery on December 22nd, and the staff had me up and moving later on that afternoon. I was on my way to the airport after having surgery to go home when I got a call from my family that my daughter was going into labor. Now that's perfect timing. The Mako Total Hip Replacement was a great choice for me. I feel better than I have in a long time. I can get back to the activities that I love to do. I should never have put it off for so long. I do a lot of walking. Walking's great exercise for me. I also use the stationary bicycle where I'm trying to build my muscles up so I can go back out on my road bike again. I would tell anyone not to wait as long as I did. I was in severe pain by the time I went into the hospital. I'm so happy with my result, and I plan to accomplish even more next year.